Alrighty, welcome back to the Millennial Thermom YouTube page and online community. I have the pleasure today of speaking with Alisa Galvan, a licensed acupuncturist and lactation consultant here in San Diego. So she's going to be able to share a little bit about her wisdom in this area, and just wanted to share the spotlight with you. Would you like to introduce yourself?
Yeah, hi. Yeah, as she said, I am Alisa Galvan. I'm the owner of Push San Diego, which is an integrative healthcare clinic where we use acupuncture and Chinese medicine to support families. I support families, specifically women and families in different seasons of their life, and specifically pregnancy and postpartum. So as a lactation consultant, it gives me a kind of a unique perspective as well as a Chinese medicine lens to approach things a little differently in the world of lactation and postpartum. But I see parents all the way from fertility through pregnancy and through the postpartum time. And I'm also a mom of two daughters.
Awesome. So what does like your day-to-day work look like? What do you typically do to support families?
Yeah, so in the clinic, I will see, average 8 to 12 patients a day. And I have pregnant people coming in. I have people working on their fertility. I have people in the postpartum time working on various issues. Why people come to me for acupuncture during pregnancy ranges from anything from nausea to fatigue to pain, any pain in the body, really pelvic pain, back pain, to really complicated issues like placenta previa or subchorionic hematomas or things like that that Western medicine can't really do much to support. I'll even have moms sometimes come in for colds or long-term coughs that are just not resolving. Because I do work with herbs as well as other Chinese medical modalities. The
Awesome.
most common thing that people come in with acupuncture in pregnancy is natural promotion of labor, so preparing the body for having the baby. And then in the postpartum time, I have people coming in to help with mood issues like anxiety, depression, fatigue, lactation issues as well. And I love that I do support on my days that I'm not in the clinic. I do travel to people's homes around San Diego County, and I provide one of my favorite things that I do is provide a long, juicy lactation consultation in the home, then an acupuncture treatment for mom. I provide acupressure guidance for parents, for baby, for partner, as well as pelvic steaming. So I got lots of tools in my toolbox, and I love that my days are varied between in clinic and then in my clients' homes.
Yeah, that's awesome. Yeah, I think that's been one of my favorite things about stepping into this like perinatal space. I think when I first decided I wanted to work with postpartum, I had no clue about the different types of supports and people in this area. And I started, the Facebooks and the Instagrams. And I mean, I met you at a networking event and I was like, wow, like this is so cool because I think that there is no one way to healing, right? And I may not have the best remedy for somebody's this or whatever it might be. Like every journey is unique. So I think when even you shared some of the movements with us that were healing and grounding, like it's something that I still do. So can you share a little bit about like what your type of like how you help families? Like what kind of things do you teach them? What is acupuncture for those who are like, I don't even know what that is?
Yeah. So I actually do get a lot of first-time acupuncture patients during the prenatal time because they know that there's not much that Western medicine can offer. So acupuncture itself is the insertion of very, very fine needles, and I would even venture to call them pins versus needles. A lot of people's concept about a needle is something that delivers or takes something away from the body. Like when I say needle, most people think, oh, a shot of vacuna, right? Or
Mhm.
or you're giving blood, they're taking blood out. So the
Take a
needle
deep
has to
breath.
be, yeah, right? So you have to have a thick needle to be able to deliver or take something away. Acupuncture needles do not do that. We're not adding anything to the body. We're not taking anything to the body. We're communicating to the body through the insertions of these very, very fine needles. And they're on a system of acupuncture channels or points. And what they do, the intention is to move energy. We say that anytime we have pain, this is a blockage.
Mhm.
Things, circulation being blood circulation, nervous circulation, lymph circulation, there's maybe a blockage. And so we want to get that to move. And so we can do that using the needles. We speak to hormones, we speak to the nervous system when we use acupuncture. So when we use acupuncture, this helps to balance the body, right? Your body has this innate desire to come back to balance, but in our environments, this can cause us to be out of balance, whether it's emotions, whether it's what we're eating, whether it's, you know, an injury that has happened to us. And so we're out of balance. And so acupuncture helps us come back into balance in a very simplistic way. Other things that I teach parents are how to do self-acupressure, so pushing on these acupuncture points, but with just pressure and massage, and that's usually accessible for everybody to do. And then I would correlate, like, for whatever symptoms they're coming in for, correlate a few acupuncture points for them to work on, or teaching partners how to do acupressure for their partners or to do it for their children. I teach breathing techniques. I teach lifestyle and dietary guidance specific to whatever imbalances that are showing up. So it is a very individualized approach to supporting families and empowering people to use tools that when they're not needing the acupuncture anymore, that they can continue and maybe use this for the rest of their life or for their kids' lives, right? Another tool I love to talk to people about is the pelvic steaming. So yoni steaming or pelvic steaming. And I do that in the clinic and I do that in people's homes, but I love teaching people how to do that for themselves for any imbalances in the pelvic area too.
Yeah, can you share a little bit more about that? Because I mean, I'm reading a book now and they talked about that too. So it made me think about you. And yeah, I think for anybody who's like, what is pelvic steaming and like, why would I need that? Can you just speak more on that?
Yeah, so pelvic steaming or yoni steaming, I call it pelvic steaming because it isn't just for women, right? As I don't do it as often for men, but we're just accessing the anatomy of the whole pelvic bowl. So any imbalances that are going on there, it could be a pelvic floor issue like prolapse or hemorrhoids. It could be an issue of trying to regulate the cycle. If we do have imbalances like fibroids or cysts or irregular periods or heavy periods or painful periods, this can help to regulate that. So we're really strategic in the timing of the steaming and the protocol. What it is sitting over literally a tea, right? A tea that it could be just the steam itself. Steam, when it rises, is warm, right? And it's moist. And so if you have used steam for anything like steaming your vegetables, you cook your vegetables, right? It's a moist heat that helps with circulation. It helps with lubrication. It helps to break things down like fibroids and cysts and endometriosis. And it's a really relaxing treatment. So typically I'll have the tea prepared with certain herbs that do infuse the tea with whatever properties we're trying to bring forward, like increase circulation or decrease inflammation. So sometimes if people come in with recurring infections or yeast infections or UTIs or things like that, we can also affect this with antimicrobials and things like that. So we can be really specific on what we're working on, but essentially we come in, we sit over this tea. I have a special seat where people sit over. We expose the vagina and the pelvic area. We allow the steam to be comfortably not too hot. We always feel the steam before you sit over, so it's not too hot. If it's too hot for your hand, it's definitely too hot for your vagina, right? So we definitely want to wait until it's a cool, comfortable temperature. We have a seat, we relax 10 to 30 minutes, depending on what we're working on. And most people, I want to say 99% of people come out of that room with a huge smile on their face, looking super relaxed. It's super non-invasive. And it's super powerful and effective too. So it's our birthright. It's found in all different cultures. If you want to learn more, the authority on steaming and where I got my certification is Steamy Chick. So steamychick.com. She has an institute if you want to learn more about this. But I definitely need to give props out to her and all she's doing, Kelly Garza's doing in the world to bring awareness to this. And I'm just loving teaching it to people and exposing to people because it's such a user-friendly modality once you figure all the logistics out and you can make it part of your overall well-being.
Yeah, that's awesome. And I think that's one thing like I really appreciate when I heard you speaking. I feel like there are so many like non-Western ways to help and support families. And if we were to just stick with the Western model, like we're losing out on some potentially really helpful treatments and just ways that ancestrally have been passed down before there was, you know, all this medical science trying to fact check everything, which is great. I'm grateful for it. But also it's like, okay, what have people been doing for generations that has been helpful? And like you said, like the pelvic steaming, I think that's something that has been around in like many different cultures. And but
Yeah, for
I
a long,
know,
long
yeah, but I don't remember my OB ever saying, hey, you should get a pelvic steaming. You know, it was like, hey, we need to schedule your induction because you're 41 weeks. And I was just
right?
like, I don't feel comfortable, you know. So,
Yeah.
or even the postpartum visit, it kind of was focused more on, right. And she was a great OB, but it was the model that we live in. It's like, okay, birth control, okay, sex, cool, all right, good to go. And I'm over here like, wait a minute, should I be peeing when I sneeze?
Right?
I don't think so. Or like, hey, I still have all these fluids. What do I do with that? Is it just normal? So I do think that a lot of times we can just feel like, okay, we just have to live with the discomfort. That's just part of having a baby. But when I'm seeing, when I hear you and other people, it's like, no, we can bring back balance. And there's different ways to bring back this balance.
Yeah, and I bring props to you, Johanna, for bringing this topic up and talking so openly about it because of these symptoms that we're mentioning, they're very common, but they're not normal, right? They do indicate there's imbalance. And
Mhm.
so just because all of your friends experience, oh, that's I happened to me too, it's just part of it. You know, if you're feeling intuitively like this is something's off, you know, then yeah, there are quite a few different modalities that can support imbalances like those things that you mentioned and the things that we're talking about. And Chinese medicine has been around for more than 3,000 years, you know, in terms of its efficacy and that fact that it's still here. It's not
Mhm.
just now being studied. So yeah, definitely. There's lots of modalities, lots of tools in our tool belt, and just bringing awareness to it. And I, again, love teaching people how to use it for themselves too, so they don't always necessarily need a
Yeah.
practitioner too.
Yeah. If there's somebody on this other side of the video who is pregnant or postpartum, or even early parenthood, what are maybe some like signs and symptoms or things that you're like, oh, I love to work with this, or like this is a great reason why people come and see me? What are some of those things?
So I see a lot of postpartum anxiety, postpartum depression, so just mental health imbalances that usually come along with this new season in your life and adjusting to that. I work a lot with postpartum scars, so C-section or belly birth and working with scars. One of the favorite things I do in any of my postpartum visits is listening, allowing space for if the person would like to, but listening to birth stories. I think it's really powerful to heal. Because a lot of births, unfortunately, can be super traumatic. And so we acknowledge that in Chinese medicine specifically, we acknowledge there's no separation between emotion and the physical, right? Like we treat them at the same time. We can't treat one without the other. So while you might just be coming in for like my neck pain when because I'm breastfeeding so much. So I have people coming in for that. I have people coming in for low milk supply. So those are a lot of the postpartum things that I love to treat. But prenatally, pretty much any symptom that you have, if you're thinking, oh, I wonder if acupuncture can help that, probably. Um, so yeah, anything in the postpartum and prenatal time, I'm super excited about supporting. Oh, I didn't mention breech or malpositioned fetus, you know, so I have a lot of people coming in. If you know at 34 weeks that your baby's breech, that's when we can start some really regular treatments and have a protocol that can hopefully help encourage the little one to come head down too.
Yeah, that's awesome. Yeah, and I love that the mind body connection is it's real. And I do think that I've seen psychology move more towards that, and there's more like holistic somatic ways, but it's always helpful to know like you can approach it in this way, in this way. There's so many different ways, like whatever entryway is where you feel comfortable with, right? It doesn't have to be therapy. Maybe you feel more comfortable like starting with acupuncture or chiropractic or whatever, you know, like start somewhere to
Mm-hmm.
get the need that you get your needs met.
Yeah.
Awesome. So what any like words of wisdom that you would want to share with any parent who is soon to be parents or freshly parenting?
I think one of the things I'm most passionate about is talking about preparing for the postpartum time before you're in it, whether that's preconception or during pregnancy. There's so much focus in our culture on preparing for the birth and preparing for the baby, right? And it's just, and that's good. We should be doing that. But we should also acknowledge this time, the postpartum's kind of forever, you know, but specifically in those first 1 to 2 months after the birth, we really want to have space, and that requires planning. And so bringing awareness, if I see a patient early in pregnancy, I'm kind of planting that seed. So what do you think about your postpartum time? Is he going to have time off? Are you going to have time off? Are you going to have support? Who's going to make your meals? You know, who's going to walk the dog? Like little things that we need to start thinking about to prepare for having this space, to get to know this new dynamic between this new little family, and what support, building a team. Lactation consultant, pelvic floor physical therapist, acupuncturist, chiropractic, all of these things. If you have those before you're in it, then you know you can just call them at a moment's notice versus trying to search it out and find this community when you're in it.
When you're sleep deprived. I remember I definitely agree. I think we need to start looking at what a modern day village looks like, because most of us aren't living with 3 generations in the home. So figuring out, okay, what type of support could there be and who could be a part of this? Because I know, at least myself, when I was, sleep deprived, the easiest thing for me to do was scroll on Facebook. And unfortunately, I got a lot of my breastfeeding advice from Facebook. And now, looking back, I'm like, oh snaps, I probably should have had 1 to 2 people that I could have gone to, or places ahead of time, because we don't always do their best coping skills when we're sleep deprived. We don't have access to them most of the time. So I appreciate that. You start, planting that seed early. I'm like, hey, let's talk about it. That's awesome. So how can people be in contact with you, or your types of services?
Yeah, so I guess the best place to check out more about what I offer is on my website, pushsandiego.com. I am on Instagram sometimes, not as much as I feel like I should be sometimes as an entrepreneur, but I'm there too. You can DM me on my Instagram as push_san_Diego. But on my website and on my Instagram, there's links to book, and you can book a free consultation through that website where it says book now, and that will put you on my schedule, and we can have a conversation virtually that can talk through any concerns or questions you might have, or if you know that you want to have an acupuncture session, you can also book that online. And yeah, that's probably the best way, is to book virtually. And like I said, if you have questions, that complimentary virtual 15-minute virtual consultation is available.
Cool. And then you mentioned that you have the clinic in San Diego, but are there virtual services that you offer? And if so, is it anywhere in the States or anywhere in the world, or California?
Yeah, so I am licensed in California. However, I do have a national license as well for acupuncture. And my board certification for lactation is international. So I can see people all over, and I do offer virtual sessions. So that is available to book online as well. You can book a virtual sessions, whether it's lactation consultation or herbal or acupressure. I do prescribe Chinese herbs for people in my clinic. So that's something else that you can book virtually as well.
Awesome. That's good to know, because I think that a lot of people, especially postpartum, it's I don't know if I want to get up and get out of the house, and knowing that they have the option of hey, maybe even just doing virtual consultation can be a great first step.
Yeah, especially when it's pretty a straightforward issue with a latch, or for lactation. And yeah, in San Diego, I travel as far as, Escondido north and down, San Ysidro to the south, and all the way out to Alpine east. So I can do home visits in the postpartum. And usually with my postpartum clients, I encourage them to have the home visit rather than trying to bring them into the clinic too, for sure.
Awesome. Yeah, we appreciate that. So do you have any last words that you wanted to share?
I don't think so. I think I covered everything I wanted to,
Yeah.
and I really appreciate the opportunity.
Mhm.
And yeah, like I said, if you have any questions, I'm always open to collaborations too for
Mhm.
events. If you are out there and you support moms and families and are looking for a way to introduce them to acupuncture, acupressure, I do acupressure ear seeds in the ear as like a trial acupuncture session, and so I do events to talk about my services and the accessibility and the the self-care tools that are really helpful. So I'm always looking to collaborate. That's my favorite way to market
Yeah.
is to be out in with people and talking to them about these wonderful, fantastic tools.
Yeah, yeah, I think that's amazing. Well, thank you so much for your time and for sharing your wisdom and expertise with everybody.
Thank you. Thank you so
Okay.
much for having me.
Of course. Bye bye.